Good morning, Bespoke Babes. It's Dr. Kim. This week, we are focusing on eyes. Everything right now is focusing on eyes because of our masks. Now, I talked about masking last week, but this week, because of the mask, we really want to focus on eye treatments because that is the area that everyone can see right now and is really focused on because we're all wearing our masks. So of course, the most common treatments that I'm sure most of you already know about for the upper face are toxes, Botox, Newtox, Dysport, Xeomin, and we really commonly put them here in the 11 lines, the forehead lines, the crow's feet. We can do a bit of a brow lift with them, bunny lines here, and pop a little bit right underneath the eyes to smooth that area out. But beyond the tox, we do have some other options for upper face and eye area. And one of those is filler. Now we usually think about putting our fillers in sort of cheeks, lower face, mid face area, but there are some areas that we can treat very, very effectively using our filler. So again, one of those is our crow's feet. So if we have crow's feet at movement only, so you only make those lines when you are talking, then our tox is going to be great because the tox works for dynamic wrinkles or moving wrinkles. If you already have static wrinkles or wrinkles that are there when you are at rest, then the tox isn't going to take them completely away. So we need to add another treatment. So one of those, of course, would be our amazing Photona laser and doing some resurfacing. But in the summertime, we don't do a whole lot of resurfacing with the laser because you really, really need to be out of the sun if you're going to laser your skin. So another treatment that we have is a combination of our RHA1 and Redensity 1 fillers. We do a combo treatment into the crow's feet. This is a very thin, light filler, almost liquidy, so we're not gonna end up with lumpy bumps into that area. And the Redensity 1 has our dermal restructuring complex in it. So again, amino acids, vitamin, minerals that are actually feeding the skin and improving the skin quality. We can put a little bit of this right into those lines very, very carefully. We can also go into the tear trough area right here underneath the eyelids, where you get that groove of transition from eyelid to cheek. So that is an area we inject with our Redensity 2. This is the only filler on the market that has actually been specifically manufactured for and approved for tear trough. So it's nice and soft. Again, we don't want to get any lumpy bumps in that area. And it has our dermal restructuring complex. Again, our amino acids, vitamins, minerals, feed that skin, help improve those dark circles. Now, anytime we're injecting into the eyelid, you're gonna swell and you're gonna bruise. It is very, very delicate skin, so you need to be prepared for some swelling and bruising and have a little bit of downtime if we're gonna do your tear troughs. We can also use our RHA1 and Redensity 1 into the bunny lines and into the glabellar lines here, if you still have those at rest. But we have to be very, very, very careful about injecting into that area because of the arteries that come up through that zone. So it is a little bit of a risky area. It's definitely an advanced technique, but it can be done. The next area we can put filler is here around the outer part of your orbital bone and particularly underneath that lateral aspect of the eyebrow to give it some lift and support and open up that top lid even more than we can do with just a Botox brow lift on its own. So if we're going to be injecting into this area, I like the Radiesse. The Radiesse does a really nice job of lifting up that brow. Or I'm going to be using something like our Lateral Volume, a gel that has a little bit more lift to it to help lift up and fill in here underneath that eyebrow, lift her up. The final area in the upper face that we can put filler in is here in the temporal fossa. So you can feel as you come along your forehead, there's kind of a ridge right here, and there is a hollow that starts to form right out in this area. In youthful faces, it's nice and full and plump. As we age, you'll notice this groove start here at the edge of the forehead, and it hollows out. That area can be filled in, and when we put a nice bit of filler into there, it can really improve the youthful appearance of the upper face. I love to do that with Sculptra. Sculptra does a really beautiful job of filling that area in, but we can also do it with something like our diluted Radiesse, our Lateral Volume, or one of our Teosyal, our Redensity 3 works really, or RHA 3 works really nice into that area as well. So there are filler options in the upper face that we can add to our talks to really give a nice rejuvenation, really make your eyes open and pop during this time when we are all wearing masks over our lower face. So as always, message or call or send us an email if you have any questions. And remember, we can do filler in all sorts of places: crow's feet, tears, troughs, our lateral brows, and our temples. So that's it for today, Bespoke Babes. I hope everyone has a wonderful day ahead, and it's so nice we're finally getting a little sunshine and nice weather out there. Have a great day, Bespoke Babes.